this is wicked. I got a whole fish on my toothbrush.
Oh my God.
For me, I feel like I was really diagnosed because the teachers recognized me like not being able to sit still. Whoa, I don't know about this one.
Oh my God.
It's not bad yet. Whoa!
Anthony, come on over here.
Good to see you.
So good to see you. I'm so glad you're here.
Thank you.
Guys, we have Dr. Anthony here from Dental Digest.
So we got toothbrushes, which I'm familiar with, a mystery array of items.
So we're gonna play a game today.
Okay.
We have some cards here. They have ADHD misconceptions. You're gonna
Okay.
tell me if they're true or false.
Yeah.
If you get it wrong, you're gonna have to brush your teeth with one of these items.
That sounds wicked. Okay.
We have wasabi, hot sauce, garlic chili oil, your face, sardines, and butter.
Oh, what is this? Okay, well, good thing I've had ADHD my whole life, so I should be able to get all these right. So if I get them right, do you brush?
No, that's not part of the game, but I do hope you get a lot
Comment
of them
down below
right.
if you think she should brush.
Okay, Dr. Anthony,
Yes?
you ready to go?
No?
We're going anyway.
Okay.
Okay, here's your first ADHD misconception. Everyone is a little ADHD sometimes. Before you answer, if you get it wrong, you're gonna have to brush your teeth with the butter.
Okay, it's not too bad of a consequence.
Oh, it's not too bad, huh?
No.
Let's do wasabi.
Okay. Hopefully I get this one right. True. The way society's built nowadays, it's not conducive to like a chill, relaxed world.
Yeah, I understand why you would say that because we live in a digital era where everything is like 5 seconds long.
Yeah.
So we all have the attention spans of like children, right?
Yeah.
But this misconception is actually false.
Oh.
ADHD is actually a neurodevelopmental disorder. So it actually is a condition that affects how someone's brain develops and functions as a child. So it's something that some people are born with. And only about 5 to 10% of people actually have ADHD.
Oh, wow.
Yeah, but there's a whole tons of reasons why people would be like distracted or all over the place.
Yeah.
But that's something else. That's just not ADHD.
That makes sense. That makes sense. Well, I'll stick to teeth knowledge. You can stick to the psychology
Okay.
diagnosis because that's out of my realm.
That sounds
so
good.
I will accept my punishment, a fair battle between Dental Digest and wasabi. So just so you guys know, this is authentic Japanese wasabi, no color and flavor added. So does it not taste like anything or what? What do we got going on here?
Oh my goodness, I'm so scared for you.
Start off with the blue, with
Oh
the
my
cap
gosh.
off.
How are you feeling right now?
Pretty good.
Oh my goodness, I'm scared for you.
Doesn't smell bad.
Actually, that doesn't smell as bad as I thought it would.
Yeah, okay. Fat glob.
Oh my God.
So I say fat glob every time I brush because I want to make brushing fun. This is not an appropriate size glob of toothpaste. All right,
Okay.
Dental Digest, let's get brushing with wasabi.
Woo!
Oh yeah.
Oh my God.
No, that's really good actually.
Oh
You
my
should-
God, I
you
could
should-
throw up looking
You should
at you.
try.
No, it's okay. It's all you.
It's actually not too.
Oh,
I promise you, it's actually not bad.
I don't believe you.
Do you like sushi?
How are
Like,
you
They
not
got wasabi
crying
on every
right
piece.
now? I have a little bit of wasabi and I'm like literally in tears. Mascara everywhere.
They got some good wasabi on set. I don't know what to say.
Okay, I love this.
Yeah.
for you.
Next question.
Hey, your eyes are getting a little red there, buddy. How you feeling?
What do you mean? Your eyes are red.
You can naturally grow out of ADHD.
I feel like over time my ADHD has gotten better, but I don't think you can grow out of it. I'm still all over the place, but I feel like I've just been better at managing it. So I'm gonna say you cannot grow out of ADHD.
Good job.
Yes!
That is correct.
I was kind of excited to brush with something weird, but I'm actually happy I got it right, so we can go on to the next question.
Well, I do want to hear a little bit more
Yeah.
about what you said. So you said when you were younger versus now, things are still a little bit hard to focus on sometimes. Can you tell me
Totally.
more?
It's been a balance of multiple years of learning how my brain works, what's the best way, I'm gonna relate this to school, what's the best way to study, what's the best way to pass classes, because I feel like traditional schooling systems really aren't designed for individuals with brains like mine, or if you have ADHD, and I also have a running list of other mental disabilities like dyslexia, just to name one, and there's a couple other, but the schooling system isn't designed for an individual's brain like mine because you have to be really focused all the time, paying attention to the teacher, paying attention to the book. I still feel like I have like wasabi on my lip.
But obviously you're a dentist.
Yeah.
So you got through it, even a school system that wasn't set up for your success. So how did you do it?
For me, I realized I am a visual learner. I did really bad in high school. failed like all my classes. I failed like chemistry class. I ended up majoring in chemistry in college,
Wow.
but graduating with a 3.98,
That's amazing.
top of the class. And it was really because I took a lot of time in college to hone in on my learning abilities and how does my brain like to learn? And that's a visual learner. So it was building roadmaps and figuring out, figuring out a topic, like a flow chart topic, and like this topic relates here at the stem, and then like having chains that go out from there. And having this visual premise allowed me to really study better, more efficiently. And actually, it's funny enough, we're creating a YouTube video today. I feel like I really owe a lot of my education to YouTube because it's very visual, right? So I'll give a shout out to a creator that I watched a lot through college and dental school. His name was Ninja Nerd. He does great flow charts and like on the medical side. For me, it was really watching those videos and understanding the visual element and to be able to put those in and connect it. So I'm all over the place with all the time with my thoughts. So having that flow chart really helped me like hone in. So that's something that I really tell like when I tutor or help other students with any like sort of classes, I usually tell them to kind of like draw it out and build like that roadmap. And
that is so inspiring to hear that you recognize, hey, my brain works a little bit different, but that doesn't mean that I have to give up. So I'm gonna figure out, how do I learn best? How can I understand what's going on? And for me, that's visual, and that's how I'm gonna set myself up for success.
Exactly.
So you're 1 for 2. You ready for the next one?
Let's do it.
People with ADHD can't sit still. Now, if you get this one wrong, you're gonna brush your teeth with the sardines.
Oh, that's like the worst one.
That's why I chose
Well,
it.
guess what? You're sitting next to me, so if I brush with this, you get to smell my breath.
Oh my God, you know what? I take it back. I take it all back.
You're saving that one for the end?
Yes, let's do garlic chili oil.
Okay, garlic chili oil, that's spicy. I can never sit still, so like, I don't know. Are all people like me? I don't really know. So that's I'm excited to dive into this with you, but I'm gonna say, yes, no one can sit still.
So you're saying, yes, people with ADHD can't sit still.
Correct.
What? Sorry about that. So that is actually false.
Yeah.
Not everyone with ADHD can't sit still.
Okay.
So ADHD, there's people who are more hyper and are fidgety and have trouble sitting still.
Yep.
But there's also a lot of people with ADHD who don't have that hyperactive type, who have more of like an inattentive type, who get distracted, maybe zone out when they're in conversations or in school or things like that.
Yeah.
And those are usually the people who don't get diagnosed, right? It's usually the people who are super hyper and jumping off the walls.
People don't see it, right? It's all internal in their thoughts.
Exactly.
Wow.
So that's actually false, and you're gonna have to brush your teeth with the chili oil.
What the heck? This looks like atomic. Like this is like, whoa, I'm not gonna flick the top. I love flicking tops off, but I am not getting chili oil in anyone's eye. So don't worry.
How does it smell?
It smells really spicy. That's how it smells. I'm scared for this one.
Let's do the pink one.
Pink one.
Yeah.
Flick the top off. Whoa.
Here we go.
Oh, this is
You got this. I believe in you.
this is all in the
No
name
worry.
of fun science because we wanna
Exactly. We're learning. Learning is fun, right?
teach the viewers about ADHD. Whoa, I don't know about this one. All right, this is Dental Digest. Let's get brushing. 3, 2, 1.
Oh God. Oh my God.
It's not bad yet. Whoa! Yeah, it's got a delayed kick.
Oh my God.
Water!
Someone get this man water.
I need water! For me, I feel like I was really diagnosed because the teachers recognized me like not being able to sit still. So for an individual that can't sit still, that still has ADHD, like what are some signs and symptoms for them to be recognized? Or like how could an individual that's like a teenager that really feels like all like the chatter in their head and going all over the place, how can they like talk to somebody and tell them like, hey, I think I have ADHD, and how can they kind of go towards that path of getting additional help?
I'm really glad that you asked this question because it can be hard, right?
Yeah.
When we think of ADHD, the signs and symptoms that we think of most commonly are hyperactivity, impulsivity, but there's also that inattention, right? So if a kid is having a lot of difficulty remembering, to do things like, oh, I forgot my homework, or I forgot that I was supposed to do these chores, or maybe just seems zoned out and people are like, are you even listening to me?
Yeah.
Right? So those are also things that you can commonly see in ADHD, even when a kid is not super hyper and super fidgety. But yeah, those are the things that we look for. Hyperness, fidgetiness, being really impulsive, but also maybe feeling zoned out sometimes. They might have difficulty controlling their emotions. We call that emotion dysregulation. And so a little trigger might make them really upset, right? And so it's all about having a little bit of a shorter fuse with things, and that's what we try to help prolong with treatment.
Awesome. Sorry, I zoned out a little bit. Can you repeat that? I'm joking, no. I guess that's a sign and symptom of ADHD. What's next? What do we got next?
Medication is the most effective way to manage ADHD. And for this one, I'm thinking we do sardines.
Okay, let's get this one right, team. Let's go. Root for me in the comments. So I started to take medication when I was in high school, but I transitioned off of it when I was midway through dental school. It helped me a lot focus. There was a lot of things that came with that drug that I didn't really like. I would say I'm more with like the right training and the right organization. I feel like I manage my symptoms better now than I did in the past. I'm gonna say it's not the best way to manage symptoms.
All right, I really appreciate hearing your perspective. That was really insightful. I'm gonna have to ding you on that.
No!
Okay, I'm sorry, I really am.
Okay,
I really am.
I wanted to brush with the sardines, so it's fine. Flick the top off.
Oh, goodness.
Yeah, give it a smell. Give it a smell.
Oh, that smells disgusting.
Yeah, I get to brush my teeth with it.
Oh, God.
Okay, let's get a good helping.
Yeah, get a real big dollop in there.
This is wicked. I got a whole fish on my toothbrush.
Oh, my God.
I've never seen a fish on a toothbrush. Boom, boom.
Make sure you get the fish on the toothbrush. I'm watching you.
Okay, you guys have to smash the like button on this video because I've never brushed with anything more like wicked than this.
This smells so bad.
All right, this is Dental Digest. Let's get brushing with sardines.
3, 2, 1.
Ooh, salty.
Oh, I bet.
Why is this?
What else? What else do you taste?
A lot of tomato. All right, let's get on to the next question because I gotta get this over with.
So medication actually is the most effective way to treat ADHD.
Can I stop brushing?
Yes, you can.
Thank you.
Okay. And so it's interesting that you mentioned that when you were younger and you took medication, sounds like you had some pretty upsetting side effects, right?
Yeah.
I'm really sorry that you experienced that. So usually when we give people medication for ADHD, if a medication doesn't work for them, it's really important that they tell their doctor, hey, I'm having a side effect, like I'm having jaw clenching like what you had, or it's making me feel anxious, because then there's always a different medication that we can try. Typically, if one medication doesn't work for someone because they're having side effects like that, we'll try out a different type of medication that might work for them without those side effects.
Nice.
But like you said, there's other things that we can advise and do to manage ADHD. Like you did behavioral techniques. I'm gonna learn how to organize my time more efficiently. Maybe I'm gonna get a planner. You know, these are things that you can work on in therapy, right? So typically, doctors, we recommend that the combination of a stimulant, medication, and therapy would be the most effective combination because then you're getting all that help from the medication and then also learning the behavioral strategies you talked about to help you become more organized and more efficient and focus better, right? But medication actually does work for about 70 to 80% of people, so it is the most effective treatment for ADHD. ADHD makes you misbehave.
Wait, what do I have to brush with this time?
Oh yeah, thank you for reminding me. Let's go with butter.
Okay, good. I needed something to neutralize the palate. My mouth is still on fire from all that spicy wasabi.
See, I can be kind sometimes.
And I bet it's probably really nice to be close to me with this great breath. Not everyone's the same, so I'm gonna answer this from my perspective, and I'm gonna say yes. I would say from all the teachers that have kind of watched me grow throughout the years, I would say they definitely see me misbehave because I have my own unconventional path to success, like success when it comes to studying or success when it comes to doing a dental procedure. I have like this brain that's like views different outlets on how to solve a problem, and that's like I feel like a strong superpower of ADHD. Gives you like a new lens to view life, and you can solve problems in a different way that other people's may say, this is the way it has to be done, this is the rules. But for me, I have, you know, a unique solution, and it's a super solution, I feel like. So I'm gonna say, yes, we misbehave in the best way.
I love your answer. I'm gonna have to ding you and say that that is false.
Okay, I wanted to brush with the butter anyways.
Right, here we go.
Flick the top off. Nice, standard butter, it's approved. The biggest issue with brushing with all this stuff is it doesn't have fluoride or nanohydroxyapatite, so my teeth are not remineralizing, so I'm not doing anything to fight cavities. So why are you making me do this?
For education.
Okay, this is gross.
People with ADHD are often labeled as the bad ones or the misbehaving people, right?
Yeah.
Because some of the symptoms of ADHD makes you hyper. It makes you blurt things out, maybe instead of raising your hand first.
Toothpaste.
Exactly, right?
Yeah.
But ADHD doesn't make people misbehave. It can just make people be a little bit more hyper or a little bit more impulsive.
Yep.
And that can often be scrutinized as bad or misbehavior in school or work settings where you're supposed to be more calm and quiet and wait your turn.
Yep.
Waiting turns can be really difficult for
I can't.
people
Nope,
with untreated ADHD.
No, yeah, I can't. Waiting my turn is really difficult.
Yeah, I bet, but that's why we have treatment.
And you talk about impulsivity, like I'm brushing my teeth with butter. Like what is
it?
It's like you knew what to do to get me to brush my teeth with butter. You're too smart.
Exactly, I'm a psychiatrist for a reason.
Yeah, that's why.
ADHD is more common for guys. And the only thing we have left, if you get it wrong, you'll be brushing your teeth with hot sauce.
I don't want to brush with the hot sauce.
I'm sure
I
you
brush
don't.
with every single thing here. So we got to get at least another question right. I'm gonna relate this back to me.
As you should.
Yes, I am a guy, I have ADHD. Those 1 + 1 = 2, so yes, true?
Correct.
Ooh, okay, and to celebrate, we should brush with the hot
Oh,
sauce.
definitely not. But I'm really proud of you
Yeah,
for getting
thank you.
that right, especially your last question. ADHD is more commonly diagnosed in guys.
Yeah.
But that doesn't mean that it doesn't also happen in girls and women as well.
Yep.
We talked about most commonly, ADHD is spotted when someone's really hyperactive or really impulsive. Those are the symptoms that we see most commonly in men. But women are often undiagnosed because they may have more of those inattentive symptoms or forgetfulness symptoms that aren't as obvious to the eye.
Do you want to brush with the hot sauce to celebrate?
You know what? Because we did this video and you were such a trooper, I'll do it.
Well, there's no
for
more
you.
toothbrushes actually, so I'll do it. So this is the last toothbrush, so it's your lucky day. For the final brushing routine, to celebrate with you guys, hot sauce. This is the last dab toothpaste version. Alrighty? Ooh, that's a fat glob of hot sauce. Final brushing routine, hot sauce.
Yes, I believe in you.
3, 2, let's go. Whoa! Whoa, this had a kick. You're lucky you didn't brush with this.
I know. Thank you guys so much for watching. Make sure you subscribe to Dental Digest and comment, like, subscribe. It really helps us out. Okay.
See you
Bye.
later. Ciao.